Hey, this is Dr. Lou Jacobs at Jacobs Chiropractic Acupuncture Center in Portland, Maine with Dr. Vela, and we are here to talk about temporomandibular joint dysfunction, TMJ dysfunction, your jaw. When your jaw hurts, there's lots of things that you can do to take care of it so that it doesn't hurt anymore without the use of drugs and surgery. And that's what we're going to discuss today. At this office, we do see a number of patients, a large number of patients with TMJ disorders. We use chiropractic and acupuncture to work on the jaw, and it's very, very effective, but there's also stuff that you can do at home before you need to seek care that you can try, and if it works, fantastic. So that's what we're going to go over tonight. Stuff that you can do at home that's going to help with your TMJ pain. The first exercise we're going to do is really simple, okay? And it's designed to activate the muscles in and around your jaw. A lot of these exercises are for strengthening and stretching the muscles that move your mouth and jaw. This particular exercise, you're going to take your tongue and put it on the roof of your mouth, touching the back of your top teeth, like this. Okay? And then what you're going to do is you're going to keep your tongue there and you're going to open and close your mouth, like this. It looks funny. It feels even funnier, but it's very effective for engaging all of these muscles in and around here. We're not going to have an anatomy lesson today. We are just going to go straight into this stuff. The next exercise that we're going to do is going to be one with resistance, where you take your thumbs or your hands and you push into the bottom of your chin and you open your mouth against the resistance of the pressure going up. You're not going like this. You're going like this. So there needs to be enough resistance that it's engaging the muscles in and around your jaw. If it hurts, stop, don't do it. Move on to the next exercise that may not feel quite as bad. But just like this, fists or thumbs, and push and hold for 5 to 6 seconds, and then repeat. And you can do this a handful of times, half a dozen times. It's great. The next exercise is right along the same lines. Instead of going down, though, with your chin, you're going to go to the side. So you're going to hold your jaw like this, not necessarily up here in the TMJ, which incidentally, here's the anatomy lesson. Right in front of the hole in your ear, you'll feel this lump. And if you move your jaw, that's where the TMJ joint is, right there. Or the temporomandibular joint. That's what TMJ stands for. But you don't want to touch that. You want to touch down here. So you're going to hold the jaw and you're going to try to push off to the side, but you're going to block it again. So you shouldn't be going like this. You should just be trying to do that. So just like this, push and push. And you hold that for 5 to 6 seconds and you repeat that half a dozen times. And then you do the other side. Again, this engages these muscles of the jaw. It makes them stronger. The stronger they are, the more resilient they are, and the better they will hold the structure of your jaw and the position in place. There are a couple of muscles that are really, really important. This one right here, it's used in chewing. It's called the masseter muscle. And then there's this muscle up here on the side of your head called the temporalis. And these muscles, when massaged, can help reduce some of the tension and irritation in through the jaw. So how do you do that? There's a couple of ways of doing it. There's a great video that I am taking some of this information from by a couple of physical therapists who are the most famous physical therapists on YouTube, Bob and Brad. This is a really good series of exercises and I give them credit for putting them together. The massage component in the masseter muscle should start like this, pushing up into the muscle like this. Just like that. And that's sort of going with the grain of the muscle, just up like that. And same with the temporalis muscle. You come up here, to the side of the head, and you push up like this. Up like this. With your fingers together, apart, with the palm of your hand, that'll work too. So you're kind of scraping those muscles out. The next thing that you can do massage-wise for these two muscle groups is you can do across the fibers of the muscle like this. So from back to front, back to front, back to front, just like this. That might even help for a headache. If you have tension headaches, that could be a very helpful thing to do at home on yourself. So there you have it. You're not moving your jaw. You're going up, up, across, across, and then you can do it again with your jaw open. So you can open your mouth and go up through and go this way. Just like that. It changes the tone and the dynamic and the position of the muscles in such a way that you're getting a different effect by scraping or massaging over those muscles. Posture is also very important for the function of your jaw. Your neck is directly and very intimately connected to your jaw and the movement of the jaw. And if you're having neck issues or even shoulder issues that cause postural problems like a turtle head or some kind of weird positioning of your head and neck, it's going to impact the jaw. So these exercises are not only good for your neck and shoulders and upper back, but they're also helpful for your jaw. The first one is like this. You take your hands like this, you grab your neck, and you kind of squeeze down on these muscles and slowly tip your head forward. So it feels like the muscles are getting dug into and sort of stripping the muscles as you tip your head forward. Okay? That's the first one. The second one is just translating your head backwards like this. So you're going to want to stand up straight, and you're not tipping your head like this. You're not tipping it back like this. You're just going straight back, just like this. And straight back, just like this. Hold for a couple seconds and do it again. Relax and come straight back. Straight back, just like that. And then the last one is this. You're going to take your shoulders and you're going to squeeze them together, and then you're going to drop them like this. So you're pulling back and then down like your shoulder blades are going into the ground. And you hold that and you squeeze it, and then you relax, and then you do it again, roll back, squeeze, and then drive your shoulder blades into the ground. You'll feel it stretching the back of your neck. You'll feel it stretching the sides of your neck, and you'll feel a lot of good tension in between your shoulder blades. This is a great, great stretch and exercise for shoulder posture, bringing your shoulders back so that your head comes back as well. That's it. Those are the exercises that you should try, provided that this is not an emergency situation. You should try these exercises first. If they help, fantastic. Keep doing them. If they don't help, you may want to seek professional help. If you have any questions, post them down below and we'll write back to you as soon as humanly possible. Thanks for watching. Good luck with your TMJ disorder.